United Healthcare Community Plan of Texas. All right, with federal requirements changing, more than 1.3 million people in Texas could be at risk of losing access to their Medicaid coverage. So what does that mean exactly? Joining us now to discuss what we need to know to maintain coverage is Jeff Maddox from United Healthcare Community Plan of Texas. Hello, Jeff. Good to see you there in Richardson.
Hey, good morning, Jenny. Good to be here.
Well, okay, let's get into it. We've been hearing a lot about how people on Medicaid could lose coverage. What's the truth here?
Yeah. Well, first, I'm glad that you're hearing about it because this is really, really important, and that's why I'm here to help get the message out and let people know what they need to know. I think actually it makes sense to quickly go back in time to before the COVID pandemic. And here in Texas, the state of Texas actually required all Texas Medicaid beneficiaries on an annual basis to renew their eligibility. And then when the pandemic struck us all in 2020, there was the public health emergency, and as that came to be, it required states to provide continuous coverage to all Medicaid beneficiaries. So for the last 3 years, there hasn't been any annual renewal of eligibility. And to size that for everyone, today there are nearly 6 million Texans that receive their Medicaid benefits through the state Medicaid programs, and that's an increase of 30% over the last 3 years. So with the public health emergency ending, it's really, really important that everyone understands what they need to do to maintain their Medicaid eligibility.
Yeah, and really quickly, why is it important for people to maintain that coverage continuously?
Yeah, it's really, really important to maintain coverage because regular doctor visits, that allows individuals and children and families to receive preventive care, critical screenings, access to services that allow them to achieve their best health. And without coverage, that may mean missed opportunities to better manage chronic conditions, to receive timely and routine vaccinations, early indication or detection of conditions that may have a negative impact on one's long-term health.
All right, Jeff, what does everybody here need to know about checking or renewing their eligibility for Medicaid coverage? I think it can seem complex sometimes.
Yes, absolutely. So first, and what's really, really important is to make sure that everyone goes out and ensures that the state has on file their most accurate, up-to-date contact information. So you can visit the website, yourtexasbenefits.com, and make sure that your phone number is up to date, your address, email, because that is how the state of Texas is going to be communicating with individuals through this process, kind of this return to normal renewal that's going to be taking place. Secondly, be on the lookout in your mail for an envelope, a yellow envelope, and in red letters it says action required. This is the communication from the state HHSC that has your renewal information in it. Some people may have already received this yellow envelope, others may be receiving it here in the future. So it's really important to be on the lookout. Then the state will be able to determine whether or not an individual still can maintain coverage through Medicaid or understand what options may be available to people that no longer qualify, such as the health insurance exchange or through an employer.
Okay, Jeff, thank you so much. Eyes out for the envelope, everybody. And then I'm going to repeat that website he mentioned. It's yourtexasbenefits.com, or call 211 and choose option 2. We will link that at cw33.com as well. And big thanks to our sponsor, United Healthcare Community Plan.